these days, more American citizens are dying of it than heart disease or cancer on a day-by-day basis, and those are usually our two top killers of Americans. And we still know so little about this disease. We don't know how many people have contracted it exactly. We don't know how many people have died from it. We don't know the number of people who carry it and don't know that they carry it. And we've had to improvise as a society. We've had to improvise our response as we learn what it is and how it works. We're not immune to the virus.
When we look at modeling, I think it's worth saying that modeling is just that. It's a model. It is in no way predictive of what's actually going to happen. So it's kind of like it's guesswork to some degree, but it's an educated guess, and it's based on data and what we do know.
And I'd suggest it gets a little more of an educated guess as we go.
Yes, and the further along we get, the better the data gets, and the more the model can hone in on probably the actual course of things. Models, and so this first curve was released by the folks at the CDPH, California Department of Public Health, and this is basically a curve that they generated with the assumption that there are no interventions left in place whatsoever. This model was generated using the Hopkins software, which is open source. You can find it online. This is based on data through March 24th, so it is a month old at this point. The reason I bring it up is because it will be helpful to try and put into context what we're talking about and what kind of time frames there are. I don't want to explain too much on this graph itself, but to maybe just highlight that we're really going to be focusing on just this first part. So this is zoomed in on that first part of the curve there, and this dotted white line, which you can see going up here, is the first part of that curve. And so using this model, they ran 1,000 simulations at 1,000 times, and they took that middle value and they plotted it out on the curve here. And this is assuming that we have, or effectively, it's the shelter-in-place orders that are in place right now. And this middle value on this blue line here is what the state is suggesting we focus on. Just below this, you can see these red dots here, and this is the actual epidemiologic curve across the state of California. And one thing you'll notice is it's tracking along just below the median value, going up and down. And you can see that as we go along in time, this gets bigger and bigger. I think what's important to point out here, though, is that as we go further and further along this timeline, you can see this upper range gets bigger and bigger. And I think one of the big takeaways here is that spread of the disease can quickly spiral out of control. And you could think of it as a 100-car freight train, and it's speeding along down a railway. You know, you have to pull a brake, and it takes a long time for it to slow down. To talk about some of the modeling we've done at the local level that takes into account the more recent numbers over the past month. So if we left things in place for the next 9 months and we ran the simulation, this is what we'll see. We see this plays out over a very long time, 9 months here, okay? And then along our y-axis here is the number of patients. And so for each of these curves, this is one point in time. This number of 145, I'm talking about 145 COVID-19 patients sitting in a hospital bed. Similarly, 64 ICU patients sitting in a bed in a hospital. 38 of them on a ventilator. And up until this point, 28 cumulative deaths. And so this death number does not take into account what happens on the back end here. People continue to die on the back end of the curve as well. We don't have the ability to test everyone we want to test. And so there's low-level circulation out in the community right now, even though we're not picking up. It's out in the community.
I mean, but to really, that point, to really understand how much is out there, we have to be able to do surveillance testing. We have to be able to test everyone who's symptomatic, and we have to be able to test a lot of people who are not, and that would give us a true idea of where we are right now. Our 0 cases don't represent the number of people with COVID in the community. They represent the number of people that we've tested who have COVID, and that's really different.
We've had to, because of limited testing, we have to prioritize who we test, and it's going to be biased because of that. We know that pre-symptomatic and asymptomatic transmission plays some role, and we thus far have mostly been unable to test those folks.
The other very quick question I have about this slide is the number of ICU beds. You say there that this would be below capacity, but the number I think that's been out there is that there are 27 ICU beds available in Humboldt County, and that seems to be much more than that.
Yeah, so the far end of the continuum of our bookend here of a potential response, and now on the complete opposite end, let's say that we've put all these orders in place, and then on May 1st, we lift the orders and people go back to behaving like they were prior to COVID-19 ever being in the world. Okay, what would that look like? So we can see here that the curves look generally the same in terms of shape, but I just want to point out a few things. This time scale is about the same, okay, 9 months, and I'll just point out that the other curves were way over here. So we see the curve here with fewer physical distancing orders or facial covering orders in place. We see that this curve gets shifted much sooner. Okay, that is one general conclusion. Additionally, these curves are all on the order of 6 to 7 times higher at peak. Okay, and again, I'll remind you that these numbers represent number of patients sitting in a bed in a hospital, and and I don't think we put this up here necessarily to frighten people, but this is what the model says, and this is based on the best available data, and this is clearly a situation that would overwhelm our hospital capacity several-fold, potentially. 976 patients sitting in a hospital bed.
At one time.
At one time. We have 408 patients sitting in an ICU bed at peak, 251 patients on a ventilator, and up until this point, we have 188 cumulative deaths, okay, and then that does not account for the deaths that occur on the downslope here of this curve. And clearly, this is just far beyond what we are capable of caring for in our community, and far beyond what we could even with robust surge plan capability be able